everyone. This is Jason Grady with Becker's Healthcare. Thank you for joining us for today's webinar, How Three Health Systems Are Overcoming Today's Workforce Challenges. Before we begin, I'll walk us through a few quick housekeeping instructions. We'll begin today's webinar with a panel discussion, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's session to access the recording. If at any time you have any issues with your audio or visual, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to introduce Enderson Miranda, Vice President of Strategic Accounts at AMN Healthcare. Enderson, I'll now turn the floor over to you to get us started.
Thank you, Jason, and welcome everyone. And thank you for joining us for our webinar on overcoming today's workforce challenges, cross-functional perspectives from finance, HR, and clinical workforce management leadership. My name is Enderson Miranda. I'm the Vice President of Strategic Clients at AMN Healthcare, the leader in total talent solutions in healthcare organizations across the nation. In my role at AMN, I have the distinct privilege of partnering very closely with the most complex and innovative healthcare organizations across the country as they really navigate, the evolving workforce landscape taken on today. And it is my great honor to bring together three of those partners today, who I have the pleasure of working very closely with for this cross-functional dialogue across finance, HR, and clinical workforce operations. They're going to be discussing today how they're navigating their workforce challenges in each organization and as they lead the organization to continue to stabilize the workforce while balancing the cost, quality, and access challenges. So without further ado, I'll turn it over to the panel so they can introduce themselves and tell us a little bit about the organization. We'll start with you first, Mamoon, and then we'll go to Patrick and Rita.
Thank you, Enderson, and honored to be here, part of this esteemed panel to talk about this very important topic. My name is Mamoon Syed. I am the Chief People Officer and Senior Vice President at the Children's Hospital Los Angeles, CHLA. We are a pediatric academic medical center situated in the heart of Los Angeles and we're actually the largest pediatric provider in the state of California, but yeah, sit in Los Angeles.
Thanks, Enderson, and to the Becker's Healthcare team for organizing this event. My name is Patrick Adams. I serve as Vice President Finance and Chief of Staff at Fairview Health Services. Fairview Health Services is an award-winning health system based in Minneapolis, Minnesota. We operate 10 hospitals across the state of Minnesota with over 34,000 team members spanning not only Minnesota, but a multi-state region.
Hi, everyone. Thanks, everyone, for having me. My name is Rita Berry. I am the Director of Workforce Management at Penn State Health in Pennsylvania. We are a 5-hospital facility, an academic medical center, and 4 community hospitals. So thank you for having me, Enderson.
Thank you all so much for joining. I'm very much looking forward to the dialogue today. And I have a few questions to kind of go through, and then we'll have some Q&A as well toward the end. So we'll kind of start with, looking at and understanding each of your individual perspectives. And we'll start with the same order that we did for an introduction. So we'll go with you first, Mamoon, then Patrick and Rita. But so from your specific vantage point, from your roles, what would you say is the single biggest workforce challenge that healthcare leaders are grappling with right now, and why do you think that is?
So from where I sit, and also the many conversations I'm having with peers in healthcare across the country, the way I would summarize the biggest workforce challenge right now is how we navigate priorities, at the center of which is our workforce. Let me try to use CHL as a quick example. So we just celebrated our 125th anniversary, you can see it in the logo, as a pediatric academic medical center. Through our history, we have become the largest pediatric healthcare provider in the state. We operate one of the largest pediatric residency programs in the country, and we are a top-tier research facility that has consistently been ranked in the top 10 nationally in NIH funding. We have done all of this. We share that with other academic medical centers, but we have done all of this while being a safety net hospital for our community in Los Angeles. There are not many institutions that can boast all of these claims simultaneously. It's what we describe at CHLA as defying gravity. The reason why this context is important to this question, and what I hear from my peers, is we recognize that the reason we've been able to do all of this stuff at CHLA for 125 years is our people. Our mission is our patients and our workforce. As the HR guy, our workforce is definitely my mission. It is the reason our mission is alive and we continue to perform miracles every day. Okay, I know I can get caught up in talking about our workforce for a long time. Let me get back to the actual question, and we can come back in a different later in the conversation around how we've been able to sustain and retain and recruit such an incredible workforce. But to the question, given this history of ours, the current reality is healthcare organizations are operating under intense and growing financial constraints. So the hardest part isn't choosing between our mission and margin. It's how do we continue to honor both, especially when the workforce is by far the single largest investment the healthcare industry makes. The challenge is how do we continue to invest meaningfully, thoughtfully in our people while remaining financially sustainable so we can care for the children and families for another 125 years. So that balance is what I see as our biggest challenge.
When I think about the single biggest workforce challenge in healthcare today, I think about for Fairview Health Services, we have a very large continuum of services. We have the 10 hospitals, we have over 40 primary care clinics, over 25 pharmacies, 90 senior housing locations, and again, 34,000 team members across the state of Minnesota and beyond who are working every day to support our communities and deliver better care and experience with new clinical service offerings with our academic partnerships. One of the unique challenges that I think Fairview experiences, along with many others, certainly with a similar care continuum, is how we can appropriately manage capacity and demand and hire to that capacity and demand and support our team members in continuing to elevate their skill set and interest to support those clinical needs. We know that healthcare nationally, and particularly in our market, is experiencing considerable pressures on the financial side and certainly constraints to what we can invest into in order to support our mission. And our ability to match what we can provide with what our patients need in real time with the right skill and the right resource has been an incredibly expensive enterprise across the United States and certainly an expensive thing for all of us in healthcare, and how we can continue to drive towards greater efficiency while continuing to deliver those services in a manner that, again, meets the capacity and the demand of the communities and the people that we serve is, I think, core to the challenge that we'll experience in the years ahead.
Enderson, I think that the biggest challenge in healthcare right now, very simply, is sustainability. It's having enough of the right clinicians in the right place at the right time without burning out the workforce and also without breaking the budget. In my opinion, there's 3 pressure points. The first pressure point that I think of every day is demand continues to rise. Our patients are sicker, our care is more complex, and our volume is now fluctuating. I used to say that I had a magic ball and I could really kind of look at volume and know what was coming at me. But anymore, I'm not too sure that I have that crystal ball, or my crystal ball may be broken. The other pressure point is supply. I think supply is constrained. Vacancies remain high. There's certain specialties that are chronically understaffed. And I also think that experience levels across teams are thinner than they ever were. And then the third pressure point is simply the workforce itself. It's changed. Clinicians want flexibility, they want predictability, and they want balance. From an operation perspective, this means that traditional staffing models don't work anymore. We can't rely on overtime, agency labor, or even the heroic effort as a long-term strategy. At the same time, from a clinical perspective, misalignment in staffing shows up immediately It shows through quality risks, staff fatigue, and fractured team dynamics. Healthcare leaders aren't just managing a staffing problem anymore. We have to redesign how work gets done in our environment, where margins, morale, and outcomes are linked.
Yeah, I couldn't agree more, Rita. So kind of tied into that, right? The challenges around not just staffing, but also engagement and ensuring, that having the right workforce. So I'll thread the needle on that, and then I'd love to get, first we'll kind of go into an HR perspective, and then I'll ask this question to you, Mamoon. Like just looking into the challenges around retention and burnout, right? That remains a top concern for healthcare organizations across the nation. So what specific HR-led initiatives have made the greatest impact for you at CHLA because you had the partnership with finance and clinical leaders and that alignment?
Yeah, it's an important caveat at the end. I appreciate that. Yeah, look, at CHLA, nothing meaningful we've done in our workforce strategy in the past few years, if there's a silver lining in the COVID years, it was that we haven't done anything in isolation, and that's been very intentional. So a few years ago, very early in our COVID journey, our CFO, CNO, and I made a deliberate decision to come together regularly, not reactively, but as proactively as possible to have holistic conversations about workforce investments. We centered these conversations around these tensions that you've just heard from myself, from Patrick and Rita, that we're trying to balance. Like, how do we bring these things into harmony? Financial solvency, capacity to deliver this excellent clinical care, and ability to recruit and retain our workforce. These challenges aren't new in my mind. I think they're just heightened. They're just more significant in their implications. So one of the most meaningful investments that we've made together, CFO, CNO, and myself as the Chief People Officer to support retention and combat burnout is the creation and continued support of our Office of Wellbeing. The objective of this office is fairly simple, but powerful. It is, as we've heard in this industry for a few years now, to care for the caregivers. The healthcare workforce has been stretched to do so much with this prolonged uncertainty, clinical complexity, rising emotional and moral burdens, and the list goes on. Burnout is real, moral injury is real, and the work environment is more challenging now than at least it has been in my almost 30-year career. So, through a deliberate cross functional commitment, we invested in this Office of Wellbeing that provides this just in time, confidential, and at times truly life saving support within the CHLA infrastructure and workforce. That includes therapeutic services, peer support, proactive outreach, meeting people where they are, both in response to acute care needs that come up, but also proactively to equip staff to buoy the impact of these crises when they do happen. This initiative, although kind of thinking it through out of HR, it was never viewed as an HR program or even a clinical add-on to support our clinical workforce. It was and continues to be an enterprise commitment. Finance understood the value of investing in the sustainability of our people. Clinic and operational leadership ensured it was grounded in the realities of what our frontline staff are experiencing. And we in HR built the infrastructure to make the support real, trusted, and accessible. And so that's how these three functions we collaborated to make this investment to help support our retention and burnout at CHLA.
I think that's a great segue actually for us to kind of think through because there's the financial challenges within healthcare systems today are so acute and broad. And you mentioned, the financial investments into that sustainable workforce. So, Patrick, I'd love to get your perspective on this. If you can share an example of, how that this collaboration, right, with your HR and clinical partners, how does that help you from a financial perspective make better workforce decisions on really understanding how to reallocate, resources and prioritize the right type of investments at Fairview?
The reality in healthcare today is that our workforce is one of the most expensive cost drivers in the system. When you really think about the expense drivers in healthcare today, labor sits at the top, and then supplies come as a close second, and then systems and facilities come as a third. And so when we look at the sustainability of our mission and ensuring that these longstanding institutions that have been here for over 100 years in support of patients, communities, and the families and communities that we support, to ensure that they can continue on another 100 years, we have to become more efficient and also do that in a way that certainly respects the individual differences of our team members, to Mamoon's point. At Fairview Health Services, we've taken an interdisciplinary approach to that work effort, and we've combined a variety of different teams, pulling in our nursing teams, our operations teams, staffing and scheduling, human resources, talent acquisition, and finance. All of those teams come together to build a cross-functional perspective that helps us better deliver on those results. One demonstrated example of that work effort is a few years ago, Fairview had a vision to better match capacity and demand and have real-time visibility of staffing outcomes and patient placement across the health system. So we brought all those stakeholders together, and 8 of our 10 hospitals operate under one centralized staffing and scheduling model, connected into one patient placement center that has real-time visibility into where our patients are at any one given moment and the resources that those patients need in order to support their care journey so they can get well and get back into the community. Those sort of outcomes led to us managing the Critical Care Coordination Center on behalf of the state of Minnesota during the COVID-19 pandemic, helping to place critically ill patients in locations that met their clinical needs and the needs of those patients, families, and communities. But importantly, what it also helped us do was better understand the equity of our labor decision making so that we can look at a unit and understand, why are those resource allocations a little different in this place versus another, so that we can explain to everyone, including a frontline nurse colleague who may be curious, why does this unit have more or less than my unit? The equity of those decisions and being able to explain them are incredibly important. So then we can hold individual leaders and teams accountable to productivity standards, to overtime standards, other drivers that help us understand, is the core business healthy, and are we managing our labor a little more efficiently, a little better each day to respond to these global demands on our resources so that we can reinvest for the next 100 years and be here for the community long term.
Absolutely. So speaking of that, that visibility, right, the data-driven decision making, and kind of looking into, how do you invest, how do you look into operations for thinking into the future, right? I think, Rita, you mentioned earlier that crystal balls are broken in some ways, right, within the healthcare system. But that being said, is the more data points and variables and partners that you have kind of as part of that, that overall predictive, modeling into where things are going, the more better off, we are to be able to kind of understand the future. So I'd love to get your thoughts from the clinical workforce operation, and how does that partnership, between, your team, your HR and finance partners help you to better anticipate, issues that might come up at Penn State? And you mentioned the staffing gaps, demand fluctuations, and as early as possible before they actually start impacting the care teams in the front line.
Yep. And Anderson, you're dead on. The one thing that you said in that sentence was, by partnering with HR and finance, we're not reacting to workforce anymore. We can anticipate much better what we need to do. With HR, when we come together with HR, we gain early visibility into recruitment pipelines, turnover trends, leave patterns, skill mix changes. That helps us identify where staffing gaps are likely to emerge before they show up as missed shifts or unsafe workloads for the care teams. And with finance, we align staffing decisions to volume forecasts, seasonal demands, and budget realities. That partnership helps us model different demand scenarios and understands financial impact of overtime, agency use, and our premium pay staff, so that we can make smarter choices when we're handing out resources and staffing and scheduling. When workforce operations and HR and finance are truly connected, we are looking at the same data, we're planning from the same assumptions. That shared visibility allows us to adjust schedules, redeploy resources, and activate contingency plans before clinicians feel the strain. So ultimately, that collaboration protects frontline teams from being in that constant crisis mode and helps ensure patient care remains safe, consistent, and supported.
No, that's perfect. And it kind of ties right into our team, right around this cross-functional collaboration. So just kind of adding to that, and Patrick, I'd love to get your thoughts as well. Like now as we look into, based on what, Rita said, and also, your expertise into the really effective cross-functional collaboration within Fairview, any examples or thoughts on how what does that look like in practice, right? We talked a lot about, some great, concepts and ways to make it work. So when you're doing that to address workforce challenges on a day-to-day, any thoughts or examples there?
Well, we've had a whole lot of that at Fairview. So, Fairview Health Services, like many organizations, particularly following the COVID-19 pandemic, had significant operating losses, and we had to modify significant areas of the organization in order to turn around the organization and ultimately reverse course on some performance trends that were troubling for our long-term sustainability. What that resulted in was a $600 million turnaround in financial performance improvement when you consider operating losses and structural inflation that we had to find a solution for. As you can imagine, with $600 million of turn in order to drive towards a future state that created, in part, the financial conditions that we could start to reinvest in the business at levels that it needed. And we certainly have more work to do on that side of the equation. It candidly looks like some controversy and some argument and some disagreement when you bring together human resources, finance, nursing, operations, talent acquisition, legal, all of these different services that have different perspectives of the organization. You certainly get different viewpoints, and those different viewpoints have tension points. With something as tricky and challenging as how you manage labor for a large organization, how you do that equitably with fairness. There's lots of different viewpoints. And my experience has been bringing together those individual parts of the organization into a collective discussion, understanding their viewpoints, being comfortable with the discomfort of some argument so that you can debate and get to a better place on the other side and help inform that perspective has been a key part to how we've modified our labor picture and continue to get more efficient while respecting and investing in our colleagues across the health system.
What about you, Mamoon? Any thoughts from CHLA?
Yeah, one of the things I think when what cross-functional collaboration looks like, a couple of thoughts come to mind. The most important one is that I don't think effective collaboration is necessarily about consensus, but I think it's about shared accountability. So practically me speaking, it means finance, HR, clinical operational leaders, everybody in the organization are looking at the same data, asking the same core questions, and owning the outcome together. It requires this one team mindset. But it does require to kind of some of what Patrick was speaking to is creating space for that discussion, for nuance, for clarity on objectives. What is it that we're actually collectively driving for? And workforce decisions are rarely binary. For example, a decision that looks costly in the short term may actually stabilize teams, reduce turnover and associated costs, and protect quality over time. So these are the kind of nuances and conversations that become critical. Shared accountability now also means for us that when aligning around a potential investment, we also have to answer the question of funding. Where is that money going to come from? It unfortunately is not going to come from better Medi-Cal reimbursement rates for us in California. So it requires us to have the discipline of identifying the trade-offs across the enterprise. Just because HR might be bringing an idea, or the clinical operations might be bringing an idea, or finance bringing an idea, doesn't mean that they're singularly responsible for identifying the funding. These conversations force us to align around our enterprise priorities. So at CHLA, the second thing I would emphasize around what cross-functional collaboration looks like, it is built on trust. And because there is such trust that we've built between us as key leaders, we trust that each function understands the stakes that others are carrying and that no one is advocating just for their lane. We're not being parochial, but for the organization and our mission as a whole, as we understand it. So, there've actually been times in some of these discussions where our CFO is advocating for the workforce, and I'm the one asking the question about financial sustainability of potential investments. So these kind of moments are signs that we are wearing our enterprise roles first before our parochial ones. This effort of, started off with the CNO, CFO, and me meeting as the chief people officer has been successful so much so that we've actually expanded that group to incorporate other workforce leaders' perspectives, clinical, non-clinical, and it worked out well. So those are the two key elements I would say: shared accountability and trust, fundamental in terms of what cross-functional collaboration can look like effectively.
I think that's really powerful to see that, when you get to the point that you're the accountability and the shared value and it's so big that you actually seeing yourself in each other's shoes, right? And that's how you overcome the challenges. That's how you do a $600 million turnaround, right, Patrick? Like what you guys did at Fairview. So Rita, any thoughts on the cross, collaboration in practice?
Yeah, just one thought that I have. I think it's really important. I mean, you all have said everything that kind of is on my mind, but the one thing that I think we've done at Penn State Health is really create a blueprint of what this forum looks like, of what cross-functional accountability looks like. And in order to do that blueprint, you put tools together that everybody can follow. A forecasting tool that the Department of Nursing, uses consistently, so that we can see, what fill rates are and what problems in staffing and scheduling that people are having. A blueprint of really reporting out in cadence, what turnover is, what source reports look like, what are the one-to-one usage. We also look at contracted labor and how do we plan to decrease contracted labor. If you choose to use contracted labor, you got to have a plan in place on how you're going to decrease it. And really following utilization. Sometimes, and Patrick, you may be upset about this, but sometimes it's hard, Patrick, to follow spend and have a goal that decreases spend because our providers, they like raises even if they're locums. Okay, so sometimes you can get a better advantage at looking at utilization, looking at your FTEs and saying to yourself, okay, we're going to decrease our utilization, our FTE utilization of contracted labor, okay, by 15%. Okay, so sometimes it's looking at it in a different way, but constantly having a blueprint to follow so that everybody's on the same page.
I
So
think, Rita, you bring up an important point. Having access to the right tools and helping to train our leaders, our teams on how those tools connect to their day-to-day work and how they individually can drive different decisions to support the long-term sustainability of the organization is incredibly important. I'll share, we've had tons of conversations at Fairview, how the little micro decisions every single day that seem really small in the moment add up to really big outcomes for the organization on behalf of our communities and patients each day. And Mamoon certainly agree that trust and the accountability to the end results and the outcomes of the organization are critical as we create space for teams to have those critical discussions and ultimately move forward in a direction that's supportive of what we're seeking to achieve, which is better care and outcomes for the people we serve.
absolutely. So as you're looking into where you are today, so your three organizations implemented a lot of different, initiatives, and to achieve, some of the current successes, but knowing that improvement and success is not linear, and I'm sure that there were some lessons learned in the past. Love to hear, and Rita, we can start with you and just saying, kind of looking back. What would you say would be like one lesson that you learned about workforce strategy that you wish you had, known earlier for your peers that are listening today?
Yeah, one lesson I wish I had learned earlier is that workforce strategy isn't primarily a staffing problem. It's a systems problem. Early on, I focused constantly on filling vacancies, covering shifts, managing productivity. But over time, I learned that those are the downstream symptoms. The real work is really building systems that anticipate demand, that align skills to care needs, and support clinicians consistently, not just in moments of crisis. I also learned the importance of integrating clinical insight in every workforce decision. When staffing, scheduling, HR, and finance operate in silos, the front line absorbs those gaps. When they work together around shared data and shared goals, the workforce becomes resilient. If I had known that sooner, I would have pushed earlier for centralized visibility, a cross-functional planning, and proactive models, because sustainability workforce strategy protects not just the organization, but the caregivers and patients at the center of it all.
That's a really good point. It's really multifactorial, right? And having that centralized visibility is really key. Mamoon, what would you say would be lessons learned from you in your journey there at CHLA?
Two come to my mind, if you don't mind, and I'll try to keep them brief. One lesson I wished I'd internalized earlier is that sometimes timing matters as much as intent. So even though the right workforce is investment, you come up with that decision, it can miss the mark if it's made at the wrong time or without the full organizational context within which that decision is being made. And that is timing not just of the investment itself, but of the communication connected to that decision made to the different key stakeholders. The when of the communication is as critical as the what of the communication. So that's something I wish I'd learned much sooner in my career and been a little bit more thoughtful and collaborative with some of the other key partners in the organization around that. And second one's a little bit more personal, that I've always believed that I'm someone that leads with my heart as much as I do with my head. 20, 30 years ago when my career first started, you wouldn't necessarily show your heart at work. It wasn't necessarily something that was welcome. But I do believe showing more of our hearts to each other is something I wish I had learned sooner and that I'd helped others learn sooner. It's something that actually my team has been teaching me over these past few years, which I really, really appreciate about the workforce strategy. So when finance, HR, operational, clinical leaders, think about these investments thoughtfully, communicating transparently, staying aligned, and giving the intent and the heart behind our decisions, I think is something that would be very valuable for people to consider as they proceed down this very difficult terrain that the healthcare industry finds itself in.
Absolutely. And what about you, Patrick? What would you say would be lessons learned around workforce strategy? Fairview.
I think one of the most important lessons learned is you have to get started somewhere and you have to go on a learning journey to navigate your way through it with a group of people. No one individual in any healthcare role is going to be successful alone. Surrounding yourselves with other colleagues who have different perspectives than yourself and being willing to engage in that discussion and trust that together you'll come to the right outcome over time based on robust debate at moments is incredibly important. And what's been foundational to our success with improving our efficiency and ultimately the sustainability of our mission has been being comfortable with we may not know what we need to know right now, but we're really good at learning and we're going to get better and learn our way through this together so that the end state continues to build upon what we've learned and we continue to build that into the systems and practice of the future to keep making ourselves just a little bit better each and every day.
So looking into building, right? So I think that's it's great. Last question that I'll ask before I open up for Q&A. I think we're probably going to have time for about three or so Q&A questions afterwards. But just looking into ahead, right, in the future and as we build, love to hear from each of you, like what gives you the most optimism about how this really next level cross-functional leadership can help build a more stable, sustainable healthcare workforce to the future. We'll start with you first, Mamoon, and then we'll go Patrick and Rita on that.
Well, I think if I were to put this response in an Excel spreadsheet, it's going to give me a circular error. The formula is a circular error because it's going to be around. So the whole conversation today has been about, our workforce and the challenge that the current financial environment has imposed upon the healthcare industry. But I mean, you've heard from three of us about there is a way out through cross collaboration. But at the heart of my optimism actually comes right full circle back in that workforce, in the people. I'm optimistic about our future because of the incredible talent that comes to CHLA on a daily basis, even amid these financial pressures and some very difficult decisions, heartbreaking decisions CHLA has had to make to do this financial turnaround that Patrick gave a little bit more detail over at Fairview, but we've had to do similar journeys despite that. I just continue to see extraordinary commitment, creativity, compassion, resolve, resilience in our mission, in our patient base, in our kids that come to CHLA for, for creating hope and building healthier futures. They are what gives me that optimism that just fuels this cross functional collaboration to solve these monumental challenges that confront us. So that's where my, again, kind of that circular argument is our people. Our people is where my hope is.
What inspires optimism and confidence for me is that we have so many committed, well-intentioned, smart people in our healthcare system and in our respective organizations who have demonstrated time and time again that they are capable of learning their way through really difficult challenges, ultimately to support transformation. I think there's a recognition in healthcare that teamwork is foundational. And as part of that teamwork, we have to continue to advance the systems and systems thinking to better support the increasingly complex and increasingly integrated environment that is healthcare. And if I look to the past, every moment we've been challenged to do that, we've learned and gotten a little bit better each day. And I certainly see that same presence continuing in the future, which gives me confidence.
Yeah, Enderson, I don't think that I can say it any better than both Patrick and Mamoon said it. I just want to say that the intention of this is so positive. And, I think if you're in a healthcare organization and you're feeling that there's silos in place, knock those silos down. Knocking those silos down and bringing all of these very intelligent people together will really create the workforce that you want. There is lots of intelligence in all healthcare organizations, and trusting one another and being accountable for your workforce is the number one thing that we can all do.
I love to hear the themes and kind of seeing how really your teams and the collaborations between the teams and empowerment of the teams and really the passion that those teams have together is what brings everyone optimism about the sustainability and the growth of the workforce. So being in the workforce space, myself, it's great to hear that. So I will open it up now for some additional questions, and with those. I will just ask them to the panel, and then whoever wants to jump in first, feel free to do that. And so the first question here is, how do you balance the short-term staffing needs? I know there was conversation earlier around contract labor and overtime. And how do you balance that with your long-term goals around retention and workforce stability? So maybe I'll start with you, Patrick, and then we can open it up since
I'm
that's
happy to start. So I think with the short-term needs, we recognize that we are dynamic systems and there are needs every single day that may not be predictable that we need to respond to in order to provide the care and experience that our communities expect of us. And some of those interventions are not sustainable over the long term. And so anytime at Fairview that we have to take more extraordinary steps with interventions that have higher cost for the short term, there's an immediate conversation with those finance, with those operations teams, with human resources, with staffing and scheduling to address, okay, this is what we need to do right now to support this need, but what's the off ramp to get to a more sustainable picture so that ultimately we can continue to support the organization and reinvest in our people, our facilities, the equipment, all the things that matter to those individuals who seek our care out each and every day. It's a tough dynamic, especially with so many things coming at each of us each and every single day from a healthcare perspective, but being very disciplined and intentional about recognizing what is temporary and having that discussion and putting in place infrastructure and accountability to move to a more sustainable picture over a period of time has been foundational.
Any other comments or thoughts from the panel on that?
Maybe the only thing I'd add is at a very practical level is how, organizations do their budgeting in terms of how to balance short-term and long-term needs is to go in very deliberately and planfully about what investments in the workforce do we anticipate and build that into the budget despite the fact that you're going to have all these external unplanned things that are going to impact, and you always have to reassess. Even the budget is not, a budget is not a set thing, but at least it's a great guidepost. So I think part of it is just planning, anticipating, and building it into your financial vision for the upcoming fiscal year. That also bleeds into a multi-year strategy that our CFO has been able to do for us as well in terms of what does sustainability look like, not just in a 1 year budgeting cycle, but 3, 4, 5 years, and the assumptions that go into that for us to be solvent. So I would say thinking about budgeting from a one year to a multi-year perspective in workforce investments.
Yeah, I always feel that when you're looking at short-term decisions, you got to look through it like through a long-term lens. Okay, so those short-term decisions are like the data that you're gathering, but you're looking farther out. And then I think for me, from a clinical standpoint, I always want to know what the core staff is thinking. And as you're maneuvering through the data, you're sharing it with the core staff so that they can tell you what you think, because you want to retain your core staff at all costs, right? So I think to me, that's what I think of the most. The short term is continually looking at the data, but you have to look through it in a long-term lens.
Yeah, and to that point, Rita, so as you are really staying close to your team, right? Just to really understand, what the challenges are, what they're looking for, how to empower them for it. What workforce challenges do you believe that maybe the healthcare leaders are still underestimating? So, and then, how can this cross-functional collaboration we talked about today can help address those unforeseen challenges sooner?
Yeah. I feel like we're underestimating the impact of experience, what I call experience erosion. I'm worried that our workforce that has a lot of knowledge is getting ready to retire or moving into a different direction. So, we talked earlier about burnout. I think we always have to have burnout in the back of our minds. So, to me, even when staffing appears stable, um, we have to know that losing our seasoned clinicians and operating in a constant high intensity mode is quietly increasing our risk. And I think that's where I lose sleep at night, because I want to think through that and make sure that we're preparing ourselves for those changes in our staffing models that we need to put into place. So yeah, so I think that's the piece that keeps me up at night.
That knowledge gap that actually came up yesterday on a client conversation. We were on site talking through some strategy around it, and they brought up the fact that not only you have the retirement of a lot of the experienced clinicians, but you have some of those that kind of were doing their clinicals, supposed to be doing their clinicals during the pandemic, that are now supposed to be preceptors, and then you have that gap that is really real, and there's opportunities that need to be there to close them.
Right. So I think having programs in place and looking at where the workforce is lacking, we have to get really innovative in making sure that we can change that piece of it, so that we have respiratory therapists and radiology techs and building those programs if we have to.
I think the
Exactly.
other component part to that work effort that we've looked at intentionally at Fairview is we recognize, again, on the core theme of sustainability, that in order to provide this care over the long term, we have to do so sustainably. And that requires a whole lot of partners who have uh, demonstrated expertise in areas that we don't necessarily have. And so partnering with academic institutions, having open discussions with those institutions in terms of what our future workforce need is, investing in those students early and often so that as they're going through their educational experience and journey, that they think of us first as the employer of choice has been certainly another important consideration that I would build on your point, Rita.
Yeah.
Yeah, and I don't know how this is if this is underestimated or not, because I would just echo what Rita and Patrick are saying. As challenging as our current workforce capacity is, I just hope we're not underestimating what the impact 5, 10 years from now is going to be, because the supply of us going into healthcare fields is shrinking while the demand is increasing in pediatric, like some of our subspecialty fellowships on the provider side. Significant number of those slots are going unfilled coast to coast, right? They're not being filled. We're not having the pipeline of talent today that can help meet the needs 5, 7, 8 years from now. Meaning, if we want to start having those slots being filled, we've got to start. Right? I mean, so I am just very, very worried about the implications of that, because when we talk about financial sustainability of the healthcare industry and the workforce being the single largest expense line item for vast majority, if not most, of healthcare operating organizations and health systems, when supply goes down and demand goes up, we know what happens to price. I don't know where the sustainability of that is, and the implications of that, I think, are really material for us as a society that I know people are talking about. And even so, I think we're underestimating what the potential impact is going to be 7, 8, 9, 10 years down the road.
Absolutely. Yeah, definitely something we need to stay very, very, very closely aligned on. We have time for one more question. And this one, Mamoon, we'll start with you. And so the question came in and said, what workforce metrics or data points have been the most effective when aligning finance, HR, and clinical leaders around shared priorities for the organization?
So obviously the ones tied to cost and dollar amounts are going to be some of the most effective ones, but not the only ones. So, yeah, the cost of care becomes important, but it really has been valued. Some of the standard, I don't think there's a lot of rocket science here, but turnover, vacancy rates, time to fill, overtime usage, engagement data, internal mobility. I think all are critical data points that we're looking at: premium labor costs, absenteeism, all of those. I think how many people are on leave of absence. I'm kind of looking at my dashboard in my head. I should have actually had it with me so I could have listed them all out. I think what's really changed and has become more effective is to actually look at them holistically versus in isolation. Like, here's turnover in the first 6 months or in the first year, and we try to solve that acute issue. I think looking at all of that data, the operational, the capacity, the impact, the quality, and the cost, and these HR workforce data, I think looking at holistically is where really the transformational piece comes in, and most effectively aligning the enterprise around our shared priorities, shared accountabilities, and shared decision making to help our ongoing commitment to our mission in a sustainable way, as you've heard about for the previous, however long we've been talking.
Enderson, I think Mamoon did a great job outlining all of the different metrics that an organization would look at. And I'm sure that if we all looked at our individual dashboards, there's probably even a couple more that we would consider. I think what's really important, though, with that information is to make sure that team members at multiple levels of the organization, so that frontline supervisor, that frontline manager, understands here's what this metric means, and here's how I can uniquely influence performance on that metric in my day-to-day work, so that at every level of the organization, our team members are not only looking at that information, but helping to determine how they can drive forward actions that's in support of a sustainable model that meets those objectives moving forward.
Yeah, I can't agree enough. I don't think that you missed any, Mamu. Um, I think for me, and I think Patrick, you kind of you drove this home. Um, working together and making sure that people understand the metrics is really important. Keeping at the metrics and constantly doing it really does paint the picture of what's happening. And then it allows people to forecast. And when people forecast, a lot of times they're right about their units. The frontline managers can absolutely forecast well. And if you miss and you don't forecast well, then you pivot. And then now you have a different idea to come up with a better staffing plan going forward. So it's really being consistent at looking at those data points and following through. And I think a lot of great ideas come up when people do that.
I couldn't agree more. So we have unfortunately come to the end of our webinar. Time flies when you're having fun. Just look at the clock here, and unfortunately, we won't be able to go through many more questions. But I first wanted to again thank our panelists for joining us for this very interactive, cross-collaborative dialogue, and I'm deeply, deeply honored about our partnership and the many years that we've gotten to work together and all of the great works that you've been doing with each of your organizations. So I'm actually going to open up if there are any closing comments that the panel would like to make as we wrap today for our audience. And thank you all that are watching us today here as well. So we'll go in the same order that we did in the opening. So Mamoon, Patrick, and Rita, if you'd like to make any closing comments there. And again, thank you so much for joining us.
Thank you, Enderson, AMN, Beckers, for this opportunity to have these critical conversations that this industry needs more of. Really appreciative of the partnerships that we've had with you, AMN, but also internally within the organization. Just keep up the good fight. We need great people like all of you here on this call wanting to learn and grow and develop to sustain our missions. Keep that resolve. We've got to do this and we've got to do this together. We can't let these forces wear us down as hard as it is. So thank you for the opportunity to speak to all of you today.
Thank you, Enderson. Thank you to the Beckers team, and thank you to everyone who's participated in the webinar. We recognize that there are significant challenges ahead, but it brings me confidence that so many team members are so deeply engaged in ensuring that communities across the country will continue to have the similar and improved access and service to care, and really appreciate the discussion today with Rita and Mamoon. Thank you both.
Yes, I just want to say thank you to all of you. It has been a pleasure meeting all of you and having this discussion. I think the most important thing that we need to remember is we want to make sure that our patients get the best care they possibly can, and developing our workforce will make sure that that happens. So thank you all. It's been great.
Well, thank you. And thank you again to the Beckers team for this opportunity to be here today.
And that is all the time we have for today. I want to thank Rita, Mamoon, Patrick, and Enderson for an excellent discussion, as well as AMN Healthcare for sponsoring today's session. Thank you for joining us today, and we hope you have a wonderful rest of your day.